All right, the name of the law that we will be discussing is called the Comprehensive Criminal Justice Reform that was signed by John R. Kasich and was supported by both the House 92 to 3 and the Senate 30 to 3. The reform was created to reduce crime by putting first-time offenders to intensive rehabilitative programming. In the program, they were put in community settings away from negative influence such as other criminals. The law also wanted to decrease incidents in prison violence. The law was made to change our criminal justice system in ways that are productive, in ways that we will open up new research and studies, and how to change stereotypes of prisons. I believe that this policy can make a huge difference if we continue to support this law. If we step outside our comfort zones and our zone and think about other people besides ourselves in the community, the world will be a better place. It all it all has to start somewhere. This is a step of change for the people that are incarcerated so they don't have to go through the roles of being judged and labeled when they are written into society. And here's a quote from John R. Kasich. I get emotional about this because I think the passage of the bill and the changing of the law is going to result in saving many lives, maybe even thousands. Before all of this is said and done, said Kasich at today's press conference, I think as we all know, the type of reform in this legislation has sat idle for 25 years. Nobody wanted to touch it. You know what? And when you're dealing with human beings, if you're going to put your own future ahead of other people's lives and their ability to reclaim their lives, you're making a big mistake. For many years, many criminal defense lawyers have tried to fight the best resolutions for the behalf of inmates. As we know, the war on drugs had a huge impact on the criminal justice system. Legislators understand that in the past, the criminal justice system had a tough stance on all crimes because of the war on drugs. From there, the support to reform the systems took a widespread for the better. Now that we have more knowledge on how to reduce crimes in prisons and know how to treat inmates that have mental illnesses, we can continue to make better decisions for everyone, those affected and not affected.
Only one-third of inmates in the U.S. with mental health problems receive treatment, according to a new Department of Justice report released in June 2017. In federal prisons, about half of those who need treatment get it, the Department of Justice found. Researchers documented self-reported experiences that demonstrate a current mental health problem in the last 30 days and a self-reported history of a mental health problem. Major depressive disorder was the most common self-reported previous diagnosis among prisoners and inmates, followed by bipolar disorder and post-traumatic stress disorder. Researchers also interviewed inmates and prisoners about how often they felt nervous, hopeless, restless, worthless, fidgety, felt everything was an effort, or felt so depressed that nothing could cheer them up. Prisons are very ill-equipped to respond to mental health challenges, and there is almost no programming in jails. In prisons, there is more programming than in jails, but it's not enough, and the programs that exist are very hard to get into. There are huge waiting lists to get into these programs, and they prioritize those re-entering society sooner. The Supreme Court ruled prisoners have a right to access mental health care. Medical care is often also inadequate too, but something like a broken arm, everybody can see it. Mental health care is still often too regarded as something that's optional, rather than something the Supreme Court has ruled is required for prisoners. According to the American Psychological Association, while the United States has only 5% of the world's population, it has nearly 25% of its prisoners, about 2.2 million people. Over the past four decades, the nation's Get Tough on Crime policies have packed prisons and jails to a bursting point, largely with poor, uneducated people of color, about half of whom suffer from mental health problems. Being the country with the highest incarceration rate in the world is really something we need to take a second look at. It's not that we have any more criminals than the rest of the world. We're just doing things we're doing different things with them. While at least half of prisoners have some mental health concerns, about 10% to 25% of U.S. prisoners suffer from serious mental illnesses, such as major affective disorders or schizophrenia. Costs for inmates to access medical and mental health care are another concern. Most prisoners enter prison as indigents. If they have Medicaid, Medicare, Social Security, or similar resources, those are discontinued. Many federal prisons, a majority of state prisons, and an unknown number of jails require prisoners to pay a copay for medical visits in attempt to reduce frivolous use of medical services. Prisoners generally pay for these services from the minimal wages they earn doing prison jobs, yet the cost of these visits can deter them from seeking preventative and routine care.
What's the first thing you think of when you hear the word mental illness? Crazy? Insane? What about the first thought? That it's not a real thing? That people fake it? Now, what's the first thing you think of when you hear the word inmate? Unruly? Heartless? And what's the first thought? A large angry man? Or a woman with no direction? Unfortunately, these are the thoughts that continue to consume a large population of the people's minds. Stigma is attached not only to one of these, but both of these issues. It's hard for many to understand why people would commit such crimes that have been put into place for a reason. A study in 2005 showed that nearly half of the inmates in the United States have a diagnosable mental illness. Incarceration may be a simple solution, but is not effective. It is a waste of time and money. People with mental illness need special care, and they need help. They need something more preventative and more long-term. If we could educate the population about how to properly treat and manage mental health symptoms, they could lead healthier lives in society than sitting in a jail cell and not obtaining the help that they need. By spreading awareness of the problem, it could not only help the person, but the taxpayers as well. The cost of an inmate with a mental illness is much more expensive than those who are mentally stable. It is common for people to continue to commit offenses once they are released if the mental health goes ignored or neglected while in prison. The individual may not be aware of the available community resources to assist with mental health, and they may not know they even have a mental health diagnosis because the way they are feeling has become a part of them. As social workers, it is our responsibility to advocate for these people. We need to spread awareness and educate the communities about how much mental health affects a person's life. We need change. When a person has a diagnosable disease, it is essential they get the care that they need in order to live as normal lives as possible. If the stigma is erased and a layer of understanding is created throughout the community, we can change a person's life. We can change safety in our community, and we can prevent the overcrowding in jails. By passing this bill, it educates and encourages an individual for health care with a mental health issue. It will give the community reassurance and safety, and it will give those who need a helping hand to guide in the right direction and lead a positive lives. We ask that you support this bill and advocate for the people who are affected, not just the individual, but the mothers, fathers, and children of inmates who are affected by mental health and incarceration.